Good afternoon, good morning, and good evening for everyone, depending on where you are joining. I know we had a lot of them registering today, so maybe I think they will be joining a little later. And now that we have a number of speakers, let's get quickly started with. Today we are going to discuss about strengthening health data governance, insights from the national assessments in Mongolia, Nepal, and Vietnam. Uh, to make a quick introduction about like how the whole thing started, uh, the Asia eHealth Information Network, AHIN, has been working closely with Transform Health since 2021 to promote and strengthen health data governance in countries. The collaboration, which began with our involvement towards development and dissemination of the health data governance principles, further extended to facilitating in-country dialogues, regional consultation on the model law on health data governance, and also support for evolving global framework on health data governance, which very soon Matle from Transform Health will be talking about. And as part of the ongoing Asia Regional Engagement Initiative with Transform Health, AHIN has been working with three countries who are here today joining us, Mongolia, Nepal, and Vietnam, in supporting legislative and regulatory landscape assessments, convening national workshops to validate key gaps, and outlining actionable recommendations to strengthen national frameworks for health data governance and to support the development of national implementation roadmaps that take care of the health data governance. Having worked with hospitals implementing electronic medical record systems, enabling telehealth services across multiple states, I would say that access to right data at the right time by the right people, especially those at the point of care, is fundamental for effective healthcare delivery. For health data to be used progressively, we need national policies and regulations that support innovations while safeguarding privacy, ensure ethical use, creating an environment that establishes clarity, accountability, and interoperability across systems. We have a number of speakers, and then Matilde, who's the CEO of Transform Health, she will be actually talking about setting the context. Let me begin with introducing her. Matilde is a founding CEO of Transform Health, a multi-sector coalition that sets out to harness digital technology and data to accelerate progress towards universal health coverage. She is a seasoned advocate and coalition builder with experience bringing cross-sector partners and networks together to deliver on global agendas. Matilde has an MA in International Studies and Diplomacy from the School of Oriental and African Studies and an executive master's in tri-sector collaboration from Singapore Management University. She's a champion of young people and women's digital and data rights and inclusion. Welcome, Matilde. Next speaker is from Mongolia, Bayalagma Baira. She's a lawyer, lecturer from the School of Law, National University of Mongolia. She has extensive experience in the banking industry and litigation with expertise in contractual labor and banking law. Her research focuses on development and prospects of information technology law in Mongolia. As a senior researcher, she is currently studying the regulation and implementation of measures that restrict online expression, including blocking of websites. Welcome, Bayalagma. Next speaker is Jabindra Bandari. He is a researcher at Tribhuvan University, Nepal, and he is an independent senior consultant with over 25 years of professional experience working in the areas of health systems, digital health governance, strategic planning, reviews, and evaluation in the health sector across Southeast Asia. His background is in public health and anthropology, and he has keen interest in health information systems, health data governance, and monitoring of universal health coverage and health-related sustainable development goals. He has collaborated with the Ministry of Health, UN agencies, bilateral organizations, international and national NGOs, academy, private sector, and civil society. Welcome, Jabindra ji. Our third speaker is Q Quang Tuan. He's a specialist, National Health Information Center, Ministry of Health, Vietnam. His work focuses on AI in health research, health data, the Health Open Data Portal, the digital health transformation. He has previously worked with the Administration of Information Technology at the Ministry of Health, Vietnam Social Security and Health Insurance Department. Mr. Tuan holds a bachelor's degree in economics and a master's degree in economics from Academy of Finance, a master's degree in health financing, security, and management from Naresuan University, Thailand, an engineer's degree in information technology from Hanoi University of Science and Technology. He has presented in various international forums such as ISPOR, HTA, Asia Link, and digital health, and has authored articles on health technology assessment, health policy, and digital health. Welcome to Juan. Our next speaker is Roland Dilip Kumar Hensman. He is a coordinator of health information and digital health at WHO Western Pacific Regional Office. And he has over 20 years of experience in health systems, serving in different development settings, including South Asia, Pacific Islands, and Mekong region. Mr. Dilip is passionate in finding practical, innovative, evidence-based solutions to health system challenges faced by countries through better health information and digital health. And Dilip is my good friend, and we had the pleasure of working together with him from AHIN for the Convergence Workshop and subsequent development of the National Digital Health Strategy in Lao PDR. Welcome, Dilip. Our next speaker is from AHIN, and she is also the coordinator for this project, working closely with me and Transform Health and the countries here. And she is Jocelyn, and she's part of the AHIN Secretariat based in Malaysia, and she has been actively involved in health data governance related projects with Transform Health since 2023. She has worked closely with countries including Sri Lanka, Malaysia, the Philippines, Nepal, Mongolia, and Vietnam to support the national landscape review and regional consultations to strengthen health data governance frameworks. Jocelyn is also a researcher at the National Institute of Health, Malaysia. She holds a degree in pharmacy and master's in data science in healthcare and clinical informatics. Her work focuses on primary care, digital health, and health information systems. With that, I've had the pleasure of introducing all the speakers for the day. And then I hand over the floor to Matilde to set the global context. And then, of course, we will start with the country presentations, starting from Mongolia, then Nepal and Vietnam, and then have the interactive part, which involves the question and answer before closure and the group photo. Thank you. Over to you, Matilde.
Thank you so much, Jai, for that great, beautiful introduction. And just to say that we're really pleased to be co-hosting this webinar today with AHIN. And thank you all to everyone that is participating online. Thank you for joining us this evening, afternoon. I know there's many competing things happening at the moment. So thank you so much for making the time. So for those of you that don't know us, Transform Health is a global coalition of 215 organizations dedicated to achieving universal health coverage by 2030 by harnessing digital technology and the use of data. And we bring together partners and networks to shape policy agendas, influence decision makers, develop tools, and also provide technical support to governments and others to deliver health for all in the digital age. As we work towards our goal of ensuring a robust, enabling environment for the equitable, inclusive, sustainable, and rights-based digital health transformation, one of our core objectives is on strengthening national, regional, and global health data governance frameworks. And we are really thrilled to work on this important issue in Asia, together with our partner AHIN and with the WHO Western Pacific Regional Office, as well as the countries that are represented on this call today. So I would like to start off by framing this issue and why strengthening health data governance, and particularly legislative frameworks governing health data, is so crucial. So health data, as we all know, is an essential foundation of modern healthcare systems. It powers policy decisions and data-driven decision-making. It drives research and innovation. It supports digital transformation and artificial intelligence. It supports health professionals to improve patient and empowers individuals to support self-care. It also supports health emergency and pandemic response, and it is central to strengthening equitable and resilient health systems and to achieving universal health coverage and better health outcomes for all populations. So with increasing amounts of health data generated in the digital age, in our everyday lives, and especially now with AI, this offers opportunity but also risks if that data is not governed effectively and equitably. And there's therefore a need for strong national legal and regulatory frameworks. There's also a need for health-specific legislation and also regional and global cooperation to ensure that we build consensus across countries around essential legislative and regulatory considerations, that we also provide a blueprint that governments can use to strengthen national approaches, and that we establish a national level of compatibility in national approaches to foster greater legal coherence across jurisdictions, as well as protocols that can support better cross-border data sharing. With all that said, there is currently a big gap when it comes to the data protection laws and regulations that exist and that is governing our health data on a daily basis, both at the national, regional, and global levels. So at Transform Health, we are committed to working with governments and partners to support advances in this space and welcome the leadership of the countries that are here today and the collaboration with our regional partners. And as part of this commitment, we are leading efforts to strengthen health data governance at national, regional, and global levels, including engaging with decision makers to build political support and foster progress. We're also convening discussions to build consensus and action. We're also strengthening collaboration with national, regional, and global stakeholders. And we're supporting regional and global cooperation and action, as well as mobilizing communities on this topic, because we believe that we need to hear from communities about the issues that they face, and to really push for stronger regulation. And we have a campaign called My Data, Our Health. So as part of our work at Transform Health and recognizing the importance of global cooperation and a global health data governance framework, we are encouraging strong government leadership and action at the upcoming World Health Assembly in May, where health data is actually for the first time on the agenda, which we're really excited about, under Agenda 12.10. So our role in this is really to ensure that discussions will lead to concrete action on health data governance. And we are working to encourage governments to support a World Health Resolution on health data governance that ensures it includes commitments on a global standard that harmonizes essential legislative provisions and protocols for responsible cross-border data sharing. So the way that we support these efforts to strengthen both national, regional, and global frameworks is through a number of tools and resources that we have developed in collaboration with our partners, including AHIN and WHO on the call here. And these can be assessed through the QR code. You can scan the QR code here on the slide or go to our website, healthdatagovernance.org. So these include an assessment tool, which provides a framework to review the national health data governance legislative and regulatory landscape. We've also conducted 24 landscape reviews that really deepen the understanding of how countries are addressing health data governance and currently taking stock of the current legislation and regulation that exist. We've also developed health data governance principles that have been endorsed by more than 175 organizations and governments that can be used across stakeholder groups to guide equity and rights-based health data governance. And finally, we have also developed a health data governance model law and a legislative guide to go with that model law that has been developed through an inclusive process with more than 1,000 stakeholders across different regions. And this model law can support efforts to strengthen health data governance, both primarily at the national level, but also inform regional and global frameworks. So just to mention the process that we go through as we support national efforts. So we are working with, as I mentioned, governments and stakeholders to strengthen their national health data governance legislation and regulation. And the way that we do that is through our support packages that I just mentioned on the last slide. And the process for doing that is first we review the national legislative landscape. We then identify gaps and strengths and needs that exist. We then build national consensus around what is needed and the way forward. And then we develop national actionable implementation roadmaps that can be taken forward by governments. So we're really thrilled about today's webinar to hear from some of the progress that has been made in Nepal, Vietnam, and Mongolia, as well as more broadly in the region. And we really look forward to continue supporting and collaborating with many countries in this process. So we encourage countries, if you're interested, do reach out to us to find out more about how we can work together and collaborate in this regard. Thank you, and back over to you, Jai and Jocelyn.
Thank you, Matilde. I think you summarized a whole lot of things that happened over years very crisply, and thank you. And then, as you mentioned, like the process of doing the assessments in countries, and then like having the gaps identified, and then having the process of engaging a wide spectrum of stakeholders is very important to have a very inclusive and comprehensive framework that also takes care of various aspects that you mentioned. So with that, I would like to actually invite Bayalagma from Mongolia. Like, she worked with us and the Ministry of Health, UNICEF, and several others together to do the assessment in Mongolia. And she would like to actually also share the experience up to the point that, we had the national workshop. Thank you.
Thank you. Good evening, everyone. Today, I would like to briefly present Mongolians' experience in health data governance and the digital transformation of the healthcare sector. Okay, my remarks will focus on 4 areas. First, the legal and policy framework. Second, current best practices. Third, existing gaps. And finally, recommendations for improvement our legal policy. So first, as we see in the slide, the digital transformation of Mongolia's healthcare sector began in 2005 with the adoption of the national program Electronic Mongolia. This program aimed to introduce digital technologies into public services, including healthcare services. One of its key objectives was the development of electronic health records, integrating health databases and paperless hospital systems. And then the next major step was other national programs, such as National Program Electronic Government, and implementing these national policies. Most recently, Mongolia adopted a comprehensive digital development package in 2021, which established the modern legal framework for the digital environment. The package includes several important laws, such as the law on the protection of personal data, and the law on the transparency of public information, and the law on electronic signature, and the law on cybersecurity. Together, these laws regulate the collection, processing, protection, and sharing of data, including health data. In addition, sector-specific legislation such as the health law and the health insurance law and the procedure for the collection, processing, use, storage, and security of health data adopted in 2024 further regulated how health data is managed. At the policy level, Mongolia's long-term development strategy, Vision 2050, promotes the integration of advanced medical technologies, AI, and digital healthcare services. Overall, Mongolia has developed an increasingly structured legal and policy framework for health data governance. As we see the best practices in Mongolia, several important best practices have emerged in Mongolia's digital health governance. First, Mongolia has established a clear legal framework for protecting personal data, including sensitive information. And the law on the protection of personal data requires consent from data subjects when collecting or processing health data, and establish security obligation for data controllers. As we see, secondly, the country has created an electronic health insurance database, which maintains unified information on insured citizens, insurance, which maintains unified information on insured citizens, insurance contributions, and healthcare service payments. This database supports monitoring, evaluation, and planning of the national health insurance system. Third, Mongolia is developing a national health data infrastructure connected to the government national data exchange system. We call it XYP, HORSE system, and the creation of the unified health database and the health data exchange system will allow secure data exchange among medical institutions. Fourth, Mongolia has introduced technical standards for healthcare software and digital systems. Regulations adopted in 2025 establish requirements for medical software and procedures for evaluating whether systems meet the national standards. Fifth, institutional capacity is being strengthened. The Health Development Center under the Ministry of Health plays a central role in the managing of health data system, digital infrastructure, and data security policies. These developments demonstrate significant progress toward the modern digital health ecosystem of Mongolia. Despite these achievements, several important gaps remain in the legal and regulatory framework. First, current legislation doesn't clearly define what constitutes misuse of health data. While unlawful use is generally prohibited, but the law doesn't specify which actions or practice qualify as misuse. Secondly, there is no specific regulatory framework for protecting vulnerable or marginal groups in the collection and use of health data. Groups such as prisoners, individuals with substance dependence, or other marginalized populations may face higher risk related to privacy or health data protection. So thirdly, there's a lack of regulation addressing bias in data systems. Health data systems and algorithms may unintentionally produce biased outcomes. Yet the legal framework doesn't currently require bias prevention mechanism during system design or implementation. First, the concept of collective consent for community health data is not regulated. Some health data concerns entire communities or population rather than individuals, so that's the main problem. And fifth, there's a limited transparency regarding cyber incidents affecting health systems, although cybersecurity laws require reporting detailed information about cyber attacks is not publicly shared, which limits opportunities for learning and prevention. Finally, there's currently no systematic mechanism for evaluating the effectiveness and impact of health data system and digital healthcare software. So these gaps show that while the legal framework is developing and further improvements are necessary. So based on this analysis, several recommendations can be proposed. First, Mongolia should define the legal concept of community health data and health-related data and establish procedures for obtaining collective consent when data concerns a specific population group. And secondly, legislation should clearly define cases of unlawful or improper use of health data to strengthen protection of privacy and human rights. Third, special mechanisms should be introduced to protect vulnerable groups, ensuring that data collection and processing don't increase risk for discrimination or exclusion. First, bias prevention requirements should be incorporated into the development and operation of health data information systems, including during the software design and implementation. Fifth, transparency should be improved by publishing information about cyber incidents and cybersecurity threats, allowing healthcare institutions to strengthen their needs. Sixth, Mongolia should establish regular impact assessment of digital health system, including evaluation of their effectiveness, benefits, and potential risks. Finally, it's very important to continue aligning Mongolia's health data governance system with international best practices while investing in research capacity, also development capacity of government organizations and digital infrastructure. So in conclusion, Mongolia has made significant progress in establishing legal and institutional foundations for health data governance. Important policies, laws, and digital initiatives are already in place. But however, further efforts are required to strengthen data protection, ensure fairness, promote transparency, and fully unlock the potential of health data for innovation and better healthcare services. So, in our assessment report, we're addressing the existing gaps and implementing these recommendations. Mongolia can continue advancing toward a secure, inclusive, and effective digital health system. So, thank you for attention.
Thank you, Biolog, for the very comprehensive summary of what has happened over the last several months. As we can see that I'm aware, like especially that Ehin worked with the government in Mongolia for the convergence workshop. Like I know that your government is very quick in terms of and then advanced in terms of the regulations. And then like I hope with this effort that we have done together with the government and Transform Health, I hope like legislation with respect to health data governance will also, be in the horizon very soon. With that, like I would like to hand the floor to Mr. Jabindra Bandari to share the experiences from Nepal.
Thank you very much, Jay, and all good morning and good afternoon. This is a kind of very interesting collaboration from ACIE Health Information Network and the Ministry of Health in Nepal. The last few months we did it. Briefly, I would like to highlight some of the health data governance related policies in Nepal. First of all, the Nepal's Constitution 2015 emphasizes principles of health data governance, particularly on the access to information and the rights and ownership. There are so many, but these are some of the key highlights of the policies. The e-governance master plan 2015 to 29, digital health Nepal blueprint, which is still draft but going to be finalized. This is another development. The Statistic Act 2023, which establishes a national data system with a kind of focus on interoperability and envisions on national data systems integrating data from government, public agencies, and other sectors. Health management information system started actually from early 2010, but it has really get matured, having the roadmap and the other integrated efforts, not only at the central level, but at the national level, but at the sub-national level also. Again, the Nepal's e-health strategy 2017, which highlights on the needs for the digital infrastructures, scaling up interoperable digital health solution. So this is also coming up and in practice to some extent. Nepal's Digital Framework 2019, which focuses on data security and privacy things, among others. In health sector, Integrated Health Information Management System Roadmap, which is a bit longer term roadmap with the Ministry of Health has already started operations and together with the partners and other sectors. I would like to present some of the good practices in Nepal. Basically, they're guided by the constitutional protection, which is provision for right to information, health and privacy and these things. We have, the Ministry of Health the government has the national health policy, strategies, and roadmap for integrated health information systems. has developed some laws, regulations, and guidelines are there. Particularly over the years, they are also becoming more useful in monitoring of universal health coverage and health-related sustainable development goals. In health system in particular, there are a wide range of information system in practices. Health management information system, logistic, medical record, health record, DHIS2, health facility registry, civil registration and vital statistics, and other program-specific reporting systems. We have also other population-based data sources that include census, health surveys, and small-scale studies like surveys, particularly the program-specific or project-specific studies, which also generate kind of data on service coverage and other things to complement the national data. National e-government interoperability framework is there. It is also operational. There is a culture of data sharing within health sector and beyond, although it is not sufficiently done. It is in progress, particularly in the context of the federal health systems and others. Data integrity, there are some efforts to maintain high standards in health data governance, balancing the innovation, privacy, and patient-centered care. During our consultations and the review, we have identified some of the critical gaps for further improvement and the next steps. Stakeholders identify that there is a limited awareness and attention of stakeholders at all levels on the existing policies and laws regarding digital health governance and its significance in the health system. There is a need also, particularly for the effective implementation of relevant laws, policies, and guidelines. We have several policies, guidelines in place, but the implementation still lacks. Effective implementation lacks. Ensuring the coherent and integrated health information systems and implementations. Another crucial part is the capacity issues across all, at national level and the sub-national level. Because Nepal has already progressed into the federal health system, the structures and the rules are being differently experienced now. Therefore, there are some sort of capacity gaps. And the emerging technologies, perhaps for that also, particularly the government and the partners need some sort of updates in the capacity issues. Basically, the capacity issues in terms of the human resources, good health infrastructure, particularly here, the information infrastructure, training, regulatory frameworks for data security and integrity. And other part is also the capturing of family and community data in health information system. There are lots of this data at the community level in terms of service provision and all these things. We have a large health information system, but the largest national system does not capture all these family and community related data. I think this is another priority, another gap in Nepal's e-health systems. So regarding the some of the recommendations and next steps, perhaps develop a health data governance framework and the implementation roadmap for actions. We have, the stakeholders, the government has drafted the national implementation roadmap in consultation with a wide range of stakeholders. Build the institutional capacity to implement relevant laws, policies, acts, guidelines at all levels. Perhaps this is more about, bridging the gap between the policy and the practice things, more focus on the implementation part. For that, we need to strengthen the coordination, both horizontal and vertical, for harmonization and interoperability of health data with health sector and beyond. Invest more on digital health governance and data literacy at all levels. Another part is the enhance the transparency and accountability in effective use of health data for monitoring of universal health coverage and sustainable development goals. So these are some of the key recommendations, among others. Thank you very much. I conclude my presentation, and I have representation from Ministry of Health, Chief of Integrated Health Information and Management Systems, and other senior officials also from government, side by side, the civil society and the development partners. So I think if there are any questions and others, we can discuss that part later. Over to you. Thank you.
Thank you, Japindra, for sharing the findings from Nepal. And then I would like to appreciate all those who joined from Nepal. I can see several. And then I know I'm aware that there are national elections, and then it's a holiday. In spite, and then some of them are on official duty. But in spite of that, being able to join, thank you very much for being with us today. I would like to hand the floor to Tuan to share the uh, work from Vietnam. Vietnam is yet to conduct the national workshop, which the other two countries have done. So just to give you that background also. Tuan, over to you.
Good evening, ladies and gentlemen from Vietnam side. My name is Tuan from the consultant from Vietnam. Today, I will share the insight from the health data governance assessment in Vietnam. What's the landscape look like, and what's working well, and where the gaps are, and what we can do next. And in the next 10 minutes, I will walk you through the main content like this. So as you can see that at the policy level, Vietnam has a strong top-down direction. So the Police Bureau and the government have issued multiple resolutions that push forward science and technology innovation and national digital transformation, public health improvement, and also the international integration as well. So the key message here is that the health data governance is not standalone agenda. So it is a portion within the national transformation agenda, meaning that there is the political momentum and the legitimacy to move from pilot to scale. We in 2025 we have issued a lot of the resolution from the Politburo, the highest level in our political level, and from as well as from government side for the digital transformation as well. So we in parallel we also see the concrete program and government instruments such as MOS Digital Health Transformation Program, the Health Data Strategies 2030, and the guidance on EMR development. So we also can see that from the regulations, the law on AI have been issued in 2025, and the technical guidance for EMR development for the whole country. And right now we achieve a lot of like in reality, around 70% of the total number of the hospital already applied the EMR right now. On the legal side, the landscape is quite comprehensive. We have core law, the covering personal data protection, cyber security, and the national data law, and the health service delivery, health insurance, the digital technology as well as the network information security and the emerging AI law we have been issued. So it's very important is that the medical device management and that also consider about the medical AI software, including software as a medical device, have been concerned right now. And we also see some the lower, like the degree and circular at a ministry level. So as you can see on the screens, it's related to the digital transformation, such as personal data protection and information system safety, and implementing the decree that data law. And at the Ministry of Health side, we also have some circular about the guidance about the system, the data safety, and electronic data extraction transfer for the health insurance, cost management, and payments. And we also see the electronic medical records, EMR. We also see the guidance for EMR deployment. We also see the information system for managing medical the examination and treatment activity. So we have like the quite comprehensive in kind of the policy for the health data as well as health transformation management. So with the nearly in total 70 the data from the document of the health data. So from the from the strength of SIP, the best practice, we observe several strengths and we can trace building blocks such as a sector specific health data regulation imaging, or dedicated health data management degrees and MOS implementation plan. So it creates a clearly policy for the sector-wide rule and institutional role. As well as, secondly, that we can see it, the privacy of frameworks provide the core principle like the purpose of limitation and data minimization, and that can be operationalized into the critical work flows. The third one, we can say that as a security by level approach is strong foundation. Right now, most software and have been developed in Vietnam need to be followed the security by level and approved by the by the official of the government. So or the approval by the one of the company or organizations that have been indicated by the government as according to the regulations. So we can see that as the first one is like they clear the EMR deployment pathway, EMR circular and technical guidance provide the enforceable the rules and for facility and to deploy EMR with the defined technical and operational requirements. And the last one, and finally, so you can see the direction of the travel for AI governance, the national AI strategy and draft. We already have been issued the law of AI. That's the end of this year. That could be the signal intent to regulate emerging technology and including risk management and finance concept relevant to health. The gap we identify here into 6 practical that can meet the trust and scale. The first one is the participant and collective, the consent, the community level governance and the collective, the consent are not yet defined in an implementable way for the minority population and the community data sets. So the second one is that data rights and ownership for the rights use, the patient rights over secondary use, and the rights around the derived product about the algorithm, model, and score remain under specified, especially like the AI or software or something. We still have not yet the policy to manage that, and the data have been right now. We have the good the policy, but the data in healthcare still fragmented. So the fragmentation across many instruments, the requirements are spread across many circular, so increasing the compliance burden and inconsistency risks for the system. So when especially we are doing right now, we are centralized the data for health at the national level. So we work with the Ministry of Military of the public and security to centralize all the data, including health. So the first one about the operational interoperability rules. So we still need stronger rule of the road, mandatory standards, conformance testing, API governance, and access tier. So the fifth one, the health AI assurance. They are limited health sector guidance on validations, monitoring, explainability, and accountability. and the bias management in clinical or public health decision making. And the sixth, the last one we found here is that the implementation capacity, skill, the data quality process, sustainable funding, and the continuous compliance monitoring are often in the bottleneck. So we have to fight with the gap here. We're still working for that to comprehensive and the solve problem as well. And the good news is the gap are addressable, and we can priority some gap partners and turn them into implementable guidance and templates. And the key recommendation and next step, I will keep recommendation action oriented. So first, adopt the national health data governance document with SOPs, workflow, and facility checklist. Secondly, they strengthen the national interoperability and data sharing framework with mandatory standards. So we already have standards right now at the national level. Further, we can share the data between the government organization and from the military under the government, as well as the official government. We have a hierarchy and the level at Ministry of Health as well. We also have a rule and standard to sharing data very clearly. So the third one to make patient and community right more realistic and tangible through the assess and correction, the audit trail and redress and pilots for the collective consent. The build a health AI assurance layer covering the validation and cybersecurity, post-market monitoring, explainability, and bias control. So invest in the implementation capacity, data quality, security operation, and workforce training, and also for the setups clear KPI as well. So we need to design for the equity and inclusion by default, especially for the low digital literacy and disability and language diversity. So we found that we will have some timeline for the next step we will do, so that we will set up the steering group to zone and to we also inform the key recommendation for that, and we will select some of the pilots. One need to be shown beyond the recommendation. We will inform to the steering committee. We have its next few months, and we will release some document that related to the degree 102 about the health data management, and also we will expand standards at national level and deploy some audits, logging, and patient access collection workflow. Launch AI registry we are doing right now. We work very closely with Ministry of Science and Technology and other ministry, and to set up the AI registry for health, and we will monitoring process, and also we are focused on centralizing data, and for long term we will establish for the needs of funding, set up for the healthcare policy, and updated for the activity leaded for this landscape for that we have been identified in this report. And thank you very much. To conclude, Vietnam has strong policy and legal momentum right now, and the next step is very to simplify and operationalize and build the capacity, and so that the data can be shared safely and used responsibly, and support better care for matters like the master, smarter like the payment, and smarter like the quality, and to support for better quality in health. Yeah, thank you very much, and look forward for your question right now, and back to the Dr. Jai and other member. Thank you.
Thank you, Tuan, for sharing the work from Vietnam. I think it's good to see the recommendations. You've been able to work it out, and then also I'm happy to see the time frame that you also showed. I think this can be discussed when as we are working together towards having the national workshop. I think it's important this to be presented and then have consensus on the way forward. So I remember like last October in 2025, Vietnam had also joined the Health AI's global regulatory network for
Yes,
responsible use of AI. I think
yes,
the work that we are currently, undertaking together with the Ministry of Health and Transform Health, I think this is also very important foundation for what to come for the responsible use of AI. I think this will be a foundation for that effort as well.
yes,
With that,
yes.
like I would like to hand over the floor to Jocelyn to have the questions from the audience. Over to you, Jocelyn.
Thank you, Sanjay, and thank you very much to all our speakers from Transform Health and Mongolia, Nepal, and Vietnam for the very insightful presentations. So now I've seen some questions coming in the chat box. So if you have more questions, please feel free to list them down in the chat box, which I will read out. So I see that there's one question from Dr. Alvin. How high does health data governance reach in your country? Ministry of Health policy, multi-sectoral policy, or parliamentary law? So can I pass this? I'll just randomly choose a country to answer. If there's other countries who want to answer, please please unmute yourself. So can I pass this to Mr. Chapindra?
Thank you. In case of Nepal, I think the for multi-sectoral kind of coordination and the institutional architecture for coordinating and harmonizing all the sectoral data within health sectors. There are certain committees, and Ministry of Health has the technical committees where the technical partners and others also join. But what is there is that just to share my experience is that up to Ministry of Health level, I think there is a good level of committees and the institutional mechanism for all these capacity things, interoperability things, and all these things. But I think for a wider kind of resource investment and the leadership, I think it has to go a little bit ahead of the Ministry of Health. For example, I would like to give one example in Nepal is that under Prime Minister office, there is e-governance board is there. So e-governance board spearheads all these data and information systems to harmonize and have all these things. But I think there is a little bit of long way to go on that. And about at the local level, I think there is a good guidance from the Ministry of Health, but in the context of the federal health system and other structural kind of new roles of the local government at the community level, I think there are some needs for the capacity and then the coordination and then reporting systems and all these things. Um, we have Ritu Panta, who is Chief of the Information Health Management Information System at the Ministry of Health, and we have also the Rupnar and Sister with the legal expert. If you have anything just to add on what I said, and apart from that, please welcome, sir. Thank you.
Yeah, thank you, Mr. Chapindra. And okay, I'll move on to the second question. Could someone other than Nepal share the challenges with overarching law on data governance, data protection, safety, AI, etc., used by health sector versus having a specific law on health data governance? The question is from Mr. Nirmal. So can I pass this to maybe Mongolia, Payalak?
Thank you for questions. So, as I mentioned before, about the main problem is that we can adopt the legal regulations and policies. The main problem is how to implementing these regulations. So it is important to continue aligning Mongolia's health data governance system with international best practices, and while investing in research, capacity development, and digital infrastructure. So about the AI and other emerging technologies, we can adopt some regulations or some policies. So the main problem is the capacity of development and have to improve the digital infrastructure. So we face to need improve the digital infrastructure and capacity of development of government organizations and etc. And that's the short answer.
Thank you, Violet. So I'm seeing would Tuan wants to also share some insights from Vietnam on this question? Like what are the challenges with having overarching law on data governance, data protection, safety, AI versus having specific law on HDG?
So from the Vietnam side, when we are issuing some kind of like the law on the data governance or from the AI as suggested, we right now before in the past we work very we set up like the timeline around 6 months to 3 years, something like that, to like the fighting and to meeting to fighting, and we have like a lot of time. We took a lot of time to issuing the regulation, especially in healthcare as well. So right now from 2025 we have been trained. It have been trained. So beyond the top highest leader from the government and the political level said that all the law and regulation not more than 3 months to set up. So right now, in 2025, we have been like the issue like a lot of the rule regulations. So the meaning in here is that the limitation beyond the centralized of the thinking, like the resources of the human resources in our country. So by training in the mind, so we have been doing it better. So we have been also not only by in the rule and regulation issuing, we also by applying the data security. We have built like the national data center. So like we manage own the area for including healthcare. So the limitation here is that we need some more like we have very clear policy. So we need some more the time and money and fund to and also the human resources needed, the high tech, the high very high technical in IT and in policy for applying the training in the digital transformation, including the data privacy, and also for the policy in digital health transformation. Yeah.
Thank you, Mr. Tuan, for the answers. Yeah, I think as you talk about timelines and all, then it actually fits into the questions that's coming up. So there are 2 questions asking about the next step. What about the next step from Nirmal asking what is the next step from Transform Health and AHIN after this assessment? And then Mr. Dilip has this question about what are the timelines that we are working on to address the compelling needs. So just to add on from the assessment that we have done currently with the countries, we also we also have a national workshop to also discuss the gaps, as well as having an implementation roadmap drafted. But to be honest, it's not being endorsed yet by the government. So I'll pass this maybe to Matilde to also expand if there's any plan from Transform Health. Or Sejai, if you want to add on, please join in.
Yeah, thank you so much. I wonder if Kirsten is on the call and she's able to take this question because she's doing much more of the implementation. Kirsten, are you there?
Yes, I am. Thanks. And hi, everyone. Yeah, in terms of the timelines, I think as you've just mentioned, Jocelyn, I think under this kind of current stage of it is working with the various countries to support kind of the finalization of the roadmaps and the kind of approval of those by government, because what the roadmaps really aim to do is set out that kind of clear timeline and next steps of what would be needed to update or draft legislation, regulation, or complementary guidance, etc., as set out and identified through these assessments. And so the roadmap would very much kind of set out then the next stages of that, which are very much kind of government-owned documents to kind of guide that next stage process. At Transform Health, we're very committed to continuing to engage with and support governments in this process. So I think once those roadmaps are finalized, then we're very happy to kind of continue those discussions with the government of where support could be needed in implementing the roadmaps, but very much see those roadmaps as being government-owned documents that can really guide the process of updating or drafting new or updated legislation, regulations, etc. But yes, I think then, yeah, very happy to kind of support where that implementation support might be needed and how we can play a part in that as well. And also just maybe to flag, as Matilda mentioned in her opening, we are also looking at if there are other countries that really want to embark on this journey and this technical support package and the tools that have been developed and kind of go through a similar sort of journey in their country. We're very happy to also explore that. So really do encourage countries to reach out. We're also working a lot both with AHIN and I know Dilip is on the call on kind of supporting similar work in the region. So yes, if there are other countries as well that want to kind of express interest in kind of supporting and engaging in such a journey as well, we very much welcome that. Thank you.
Thank you, Kristen, and thank you, Matilde. Okay, I'll just read out the last question for the day. What about feedback mechanisms working in all the tiers of governments such as Vietnam and Mongolia? I think it's still about sharing the experience as well. Can I pass this question to Ms. Bayala first?
Yeah. Thank you for questions. And in the digitalization of health care and health governance, the Ministry of Digital Development and Communications and Ministry of Health worked together and collaborated at the policy level. But however, challenges arise when cooperating with other government institutions. For example, data sharing is implemented through the agreements with the National Data Center under the Ministry of Digital Development and Communications. So nevertheless, there are cases where the process of concluding such agreement is not carried out consistently. So therefore, in order to strengthen governments, it is essential to improve interagency cooperation among government institution. So in Mongolia, the main problem is we have to resolve that, improve the cooperation with government health government organizations and build the health data governance. So that's the short answer. Thank you.
Thank you, Ms. Bayala, for the answer. Yeah,
I
and
think
I
this
would like
question
to...
with respect to Vietnam because Vietnam is yet to do the national workshop. Just to remind on that. Over to you, Tuan.
Yes. So for the question about what about the feedback mechanism working in the tier of the government, such as our country. So we as you know that in our country right now have the three level only, from the central level, provincial level, and also the grassroots level. So for at the ministry level, when we doing we issuing some policy in the health data governance. So we will applying we will see some the hospital at the provincial level, the central level, and as well as the grassroots level. They will found some the trending in policy. So the feedback mechanism here is that in some policy, in some medical regulation, they will send officially by the letter. And when after applying some policy, if we found that, if they found that, if they find some missing, some unacceptable, they will write down on the paper official letter and send back to the issuing and the responsible organization. And for the data data and data management. So also like that, we will providing some account for the lower level that we manage by on the data center, the national data center. They can access, and the mechanism here is that if we find some misusing the unacceptable asset from the local level, we will inform them officially, and we also using some technical mechanism to limit them to access the data at national level. So I mean here that's all the mechanism feedback based on the reality activity from the policy level as well as for the technical level. So beyond some of the official level from the local to central level. Thank you very much for we are doing right now some step for the next few weeks for national workshop. We will also discussing the gap and the limitation, and also is discussing with some changing in the very much in the 2025 about the digital transformation in health. So we may invite Dr. Zai and the other member from Transform Health and Jocelyn and WSO. We may come, we may discuss more, and maybe find out more some the limitation in our country, and have maybe get some recommendation from you. Thank you very much.
Thank you, Tuan, for the kind invitation. We also look forward to have the national workshop in Vietnam very soon. I think we are already at the top of the time. I would like to request Dilip Hensman from the WHO regional office in Manila to give the closing remarks, and then we will also take a group photograph. I know for some of us it's quite late, but please do stay back for the group photograph, and then we can end the day. Over to you, Dilip, for the closing remarks.
Thank you so much, Jai, and a very good afternoon and a good evening to everyone. As we come to a close of this AHINAM, I would like to begin by warmly congratulating Mongolia, Nepal, and Vietnam for undertaking such a thorough and thoughtful assessment. Completing assessments of this nature, as we all know, is no small task. It requires a lot of leadership, cross-sectoral collaboration, and willingness to look critically at existing systems in order to strengthen them for the future. So the work you have shared today demonstrates strong commitment to safeguarding health data while enabling its responsible use for better health outcomes, which we all strive towards. I would also like to express my sincere gratitude from WHO Western Pacific Regional Office to my colleagues and close collaborators from AHIN, Jai and team. Dr. Alvin is also there. And of course, Transform Health. AHIN has over many years played a vital role in convening and knowledge sharing across the region, and Transform Health has been a keen partner in advancing the global agenda on health data governance. WHO Wipro is also pleased to have a project collaboration agreement with Transform Health, and we value the support both organizations have provided to the three countries featured today. This discussion is especially timely. We are at a moment where digital health and artificial intelligence are rapidly reshaping health systems. While these technologies offer enormous potential, they also heighten the importance of strong health data governance guardrails to ensure data is used safely and ethically in ways that build public trust. Governance is not about slowing innovation. As we all know, it's about enabling innovation that is responsible, equitable, and aligned with public health values. So it was great to see all the considerations relating to health data governance in the age of AI today. So I particularly congratulate all three countries on this. For Mongolia and Vietnam, I like to emphasize that WHO Wipro remains committed to supporting you in your journeys ahead. And I'm sure CRO also would do the same for Nepal. And we have discussed, as we have discussed today, the assessment is not the end. It is very much the beginning of a long journey ahead. The real value lies in how findings inform practical roadmaps that will help chart the path forward from policy and legislation to institutional capacity and implementation. So we all heard about these gaps as well, from what's on paper to what's implemented. So there is a lot of work to be done in this area. And of course, WHO stands ready to continue walking alongside you as these roadmaps take shape. Finally, today's exchange has shown the power of cross-country learning as well, how countries can learn from each other's experience while contributing to a broader global movement. So including discussions around the World Health Assembly resolution on health data governance, as Mathilde had alluded previously. So thank you once again to all speakers, partners, and participants for your insights, engagement. And we look forward to continuing this important work together. Thank you, and a very good evening to all of you. Thank you.
Thank you, Dilip, for those wonderful concluding remarks. Like, you summed up a lot of things in those few words. And as you rightly pointed out, it's a beginning, and we have still a long journey to make. And then it's also very interesting because each country probably will have a slightly different gaps, and then the approach to the roadmap. But this is an occasion that where each one could actually get to know what the other is doing, and then collectively this should lead to something better. Thank you very much. And then I would like to leave the floor to Cha and Jocelyn for the group photograph before we call it an evening. Thank you.
Thank you,
Thank
Dilip.
you.
Thank you.
Thank you very
Bye.
much, Dilip.
Thank you.
Jai.
Bye-bye.